I have gathered all of my equipment and supplies. Hello, my name is Renata. I'm going to be your nurse today.
Hello.
Can you please verify your name and date of birth?
Idalia Palomo, 42183.
Okay, thank you. I will perform hand hygiene and provide for privacy. Now, Miss Dahlia, are you in any pain today? On a scale of 0 to 10, 0 being no pain at all, and 10 being excruciating pain, what would you rate your pain?
0.
Okay, good. Today I'm going to be performing a head-to-toe assessment on you. That means I'm going to be listening to your heart, your lungs, your abdomen, and I'm also going to be performing a neuro and a motor test. Before I do that, I will be doing a general inspection. I see a healthy, young, well-nourished female with good hygiene and good posture. Also, before we begin, do you need to get up and use the restroom? Okay, you're comfortable in regards to temperature? Good. Now, do you know where you are?
Staples Community Hospital.
Okay. Do you know what day it is?
April 22nd, 2018.
Okay. Do you know who our president is?
Donald Trump.
Okay. My patient is alert and oriented to person, place, and time. And at this point, I would take your vitals. That means I would take your blood pressure, temperature, respirations, pulse ox, and your pain scale. And if at any point I notice any gross abnormalities, I would stop the assessment and notify your healthcare provider. Okay, so I'm going to start my assessment off with your head. And I am doing a general inspection, and I notice that the head is normal, round, cephalic. I'm feeling, and I don't feel any lumps, no overly dry scalp, no abnormalities in the head. The hair is evenly distributed. And then I would turn back around and check your sinuses. Tell me if you feel any pain. No pain in the sinuses. Good. And then I would do your cranial nerves, starting with cranial nerve number 1, which is your olfactory. So I'm going to ask you to cover your right ear. Okay, and tell me what you smell.
Alcohol.
Okay, cover your other ear. Tell me what you smell.
Alcohol.
Okay, good. So cranial nerve number 1, olfactory, is intact. And then I would assess your cranial nerve number 2, your optic, using your Rosenbaum chart. And I'm assessing your nearsightedness. Will you close your right eye? And can you read this line for me?
8745.
Good. Can you read this line for me?
863820.
Okay, good. So 20/20 vision with no corrective lenses means your cranial nerve number 2 is intact. And then I would assess your cranial nerves number 3, 4, and 6, which are your oculomotor, your trochlear, and your abducens. And I will do that using my pen light. Okay. Okay. So pupils are equal, round, and reactive to light and accommodation, and they are approximately 4 millimeters. Okay, and I'm going to ask you to follow my pen light. Okay, so cranial nerves number 3, 4, and 6 are intact. And then I would assess cranial nerves number 5, 7, 8, and 11, which are your trigeminal, your facial, your acoustic, and your spinal accessory. So I will ask you to close your eyes and tell me where you feel the sensation and whether it is soft or sharp.
Forehead and soft. Left cheek and soft. My chin and it's soft.
Okay, now can you clench your teeth? Okay, can you smile, frown, raise your eyebrows, pucker your lips, and Can you raise your eyebrows or close your eyes against resistance? Okay, good. Close your eyes again and tell me where you hear the sound.
Nothing. Right here.
Okay. And now can you shrug your shoulders? Okay, shrug them against resistance. Good. So cranial nerves number 5, 7, 8, and 11 are intact. And then I would assess cranial nerves number 9, 10, and 12, which are your glossopharyngeal, vagus, and hypoglossal. And I'm going to do that using my tongue depressor. First, I'm going to ask you to stick your tongue out, move it up and down, side to side. Okay, now I'm going to ask you to do that against resistance. Okay, good. And now can you swallow? Good. Open your mouth. I'm checking the oral mucosa. I noticed that it is pink and moist. I don't know any foul odor or dental caries. Okay. So that means cranial nerves number 9, 10, and 12 are intact. And then I would do, and then move down to your neck, I would do a general inspection. I noticed that the trachea is midline, there are no curvatures. I would palpate your lymph nodes and tell me if you feel any pain.
No.
Okay, I don't know any tenderness. Okay, and then I would listen to your carotid arteries with the bell of my stethoscope. And I'm listening for bruits. Hold your, take a deep breath, and then hold your breath. Good, I don't hear any bruits. Take a deep breath, hold your breath. No bruits. Then I would check your carotid pulse. 2+. 2+ bilaterally. And then I would move down to your upper extremities of your arms. Doing a general inspection, I note that it is appropriate color for ethnicity, tan. It is dry and warm to touch. And at this point, I would check your radial pulse. 2+. 2+ bilaterally. And now can you rotate your wrists, rotate your elbows, and rotate your shoulders, rotate your neck. Okay, so you have full range of motion in your upper extremities. And I'm going to check your strength like this. Push against resistance. Can you press my fingers? Okay, so your strength is 5+ in your upper extremities. And then I would inspect your chest. I noticed that it's appropriate color for ethnicity. It is warm and dry. I don't notice any tenting. And then I would listen to your heart. I'm going to start with your aortic, which is second intercostal space, midclavicular line. Then I would move to your pulmonic, second intercostal space, left sternal border. I hear a normal S1, S2, regular rhythm. And then I would move down to Erb's point, third intercostal space, left sternal border, and I hear a regular S1, S2, normal rhythm. And then I would move down to your tricuspid, fourth intercostal space, left sternal border, and I hear a normal S1, S2, regular rhythm. Then I would move down to your mitral, which is your fifth intercostal space, midclavicular line, and I hear a normal S1, S2, regular rhythm. And then I would go through that again with the bell of my stethoscope. And I would also check your apical pulse for 1 full minute. Okay, and then I'm going to listen to your lungs. I'm going to listen to your posterior, anterior, and your right and left lobes. I'm going to start with your posterior, and I'm going to check 12 different locations. I'm going to ask you to take deep breaths for me. Deep breaths. Deep breaths. Deep breaths. One more time. Good. I'm going to check 3 spots on your right lobe. Breaths. Good. I'm going to listen to 2 spots on your left, each lobe. Good. And then I will check 7 spots in your anterior, and I'm noticing that throughout there's been clear lung sounds. I don't hear any wheezing. Start here. Okay. And I hear clear lung sounds. Okay. And at this point, I'm going to assess your abdomen. So I'm going to ask you to lie down. And I'm doing, first I'm doing a general inspection. I see a round stomach, no distension. It's soft. And then I would auscultate all 4 quadrants, listening to your bowel movement. And I hear normal active bowel movements in all 4 quadrants. And then I would percuss your abdomen. And I hear normal tympanic sounds in all 4 quadrants. And then I would do soft palpations. Tell me if you feel any pain. And I don't feel any tenderness. Okay. And at this point, I would check your femoral pulse and do a general inspection of the genitalia. I would know any drainage, tubes, or foul odor. And then I would move down to your lower extremities. I'm doing an inspection of your legs. I notice that they are tan, appropriate color for ethnicity. They are dry, not overly dry, and warm to touch. And at this point, I would assess the pulses of your foot, starting with your pedis dorsalis, and I feel 2+ pulse, 2+ bilaterally, and I would check your posterior tibialis, 2+, 2+ bilaterally. I would check your popliteal, 2+, 2+ bilaterally. And then I'm going to assess your range of motion. I'm going to ask you to lift this leg up. Good. Lift this leg up. Bring it up to your chest, starting with this one at a time. And bring this one up to your chest. Good. I'm going to assess the range of motion in your hips. Good. So you have full range of motion in your lower extremities. And then I'm going to assess your motor strength. Ask you to push against resistance. Good. Bench resistance. Oh, good. So you have 5+ strength in your lower extremities. And then I would ask you to sit up slowly. Do you feel dizzy? Are you okay?
I'm okay.
Okay, good. And now I'm going to ask you to stand up, and I'm going to assess your gait. I'm going to ask you to take 3 steps forward. While you're doing this, I am assessing your spine. I see that it is midline. I don't know any curvatures or abnormalities with your spine. I would ask you to take 3 steps back. Good. So patient is able to ambulate on her own without any difficulty. And then I would assess your balance. I'm going to ask you to close your eyes. I'm standing by you to make sure that you don't fall, and I don't know any excessive swaying. So you have a steady balance, and you may now have a seat, and that is the end of my assessment. Do you have any questions?
No.
Okay, thank you. I'm going to wash my hands and leave the room, and I'm going to document my findings.